Good day, everyone. In this video, we are going to continue the discussion on comprehensive application of diagnosis. In the previous videos, we have introduced how to collect the clinical information and what are the important aspects of the clinical information, such as the completeness, systemization, accuracy, and consistency of the clinical information. Also, the other part is from the clinical information. We also need to, especially when we study, we need to try to identify the very typical manifestations. What does it mean? From the study, you have studied a lot of symptoms, such as the patient will feel, such as the symptoms of headache, palpitation, of fever, cough. You see, these common symptoms, or also such as fatigue, these common symptoms is very common, and you cannot identify from these symptoms only. So what you need to remember is to try to remember the very typical symptoms, such as if you want to diagnose a patient with ink deficiency, you need to ask about the night sweat. Does the patient sweats when they sleep? You need to ask about if the patient experienced the hot feeling in their palms and under their soles. So these are very typical symptoms for ink deficiency. Also, if you want to identify the yang deficiency, you can ask about does the patient feel cold, or does the patient present with cold hands and feet? So these are very typical symptoms for specific syndrome. These key points are the aspects that you need to memorize, you need to study. You need to understand and start and focus more on your study. These are the typical symptoms that can help you to identify the specific symptoms. The thinking methods of the syndrome differentiation. We have studied many syndrome differentiation methods, but how to use them? What's the theory behind the application of the syndrome differentiation? So these are the theory that we are using. The first one, analogism. Analogism, it means that you're going to compare with something. So from the clause, from the textbook, it tells us a patient presents with aversion to cold, fever with no sweat, headache, body pains, superficial and tense pulse. This is a Taiyang syndrome. So this clause is from Sanhan Lun, from the classic. So if you remember this clause, when a patient comes to you, the patient tells you, "Good day, doctor. I feel cold. I got fever with 38 degrees. I don't sweat. I got slightly headache on top of my head. I got the body ache." And then when you feel the pulse, you feel the pulse is very superficial and tense. So in this situation, you can diagnose that the patient suffer from a Taiyang syndrome. So that's how to use the differentiation method. Very similarly to the other situation, a patient presents with palpitation. The patient can feel the heart is beating. The patient feel cold. The patient have cold hands and feet. The patient also feel cold with white or pale complexion. pale tongue, enlarged tongue with teeth mark. And then from the textbook, you will know this is a yang deficiency, a hard yang deficiency syndrome. So when a patient presents with these kinds of manifestations, you will know that this is a hard yang deficiency syndrome. So that's how to use this differentiation methods. The second one is the induction. What does it mean by induction? In order to apply the method of induction, the way of thinking is very important, especially from the inquiry. That's also why we need to systematic the clinical information. We don't ask the random questions. Because from the clinics, the patient will present with many different unrelated manifestations and symptoms. So from here, we need to focus on the chief complaint. We also need to focus on the manifestations that's related to the chief complaints. That's the induction. For instance, patient presents with edema in the legs, with scanty urine, enlarged tongue, watery coating. So in this situation, we will know that the patient might suffer from water retention and from the chronic situation, fatigue, cold, aversion to cold, and cold hands and feet. Pale tongue, we know that this is a situation might from yang deficiency. And the other patient with fullness, distending feeling in the abdomen, poor appetite, and sometimes with loose stool. Now we will know that this is related to the spleen. So in order to perform the induction, you need to systemize the clinical information. You're going to use one clue to link everything. If they can be linked, then you can go to one root cause from the syndrome. The third one is the deduction. The deduction, we're going to analyze from the manifestation. Sometimes the manifestations will be changed. For instance, a patient presents with fever from the exogenous pathogens. So the patient jumped in the pool in the summer in the party, and the second day the patient got fever or runny nose. So in this situation, the patient presents with bacterial syndrome. The patient feel fever and have runny nose. That's in the evening. The fever happens in the early morning. And then your practice only open from 9 o'clock. The patient got the appointment at 10 o'clock. Then when the patient comes to you, the patient don't feel aversion to cold anymore. The patient feels that's thirsty. And when you see the patient with red tongue and yellow coating with rapid pulse, in this situation, you will see that the disease or the pathogens already developed into the interior. The patient don't feel aversion to cold anymore. So there's no exterior syndrome. So these are the deduction. You're going to analyze from the symptoms, from the manifestations, and then you're going to analyze from different aspects. It might be from the causes, it might be from the time, the duration. So you from the general manifestation, you go to more details. You're going to analyze what happened to the patient, what's the causes, why. So all the deduction try to explain why the patient will present with thirsty, why the patient will have a red tongue. When you ask why, you use the theory to explain the manifestation. This is a kind of deduction. The pedagogy. A pedagogy is something that's very important to help us to exclude some diseases. For instance, a patient with a headache, it's very important to us that they feel nausea, especially the severe nausea and vomiting. If the patient does not present with severe nausea and vomiting, then you can relax. The headache is not from the brain problem, because if the pressure in the brain increase, the patient will have severe vomiting. That's another very different story. So when you see the headache with no vomiting, no nausea, then you can conclude that the headache and the headache is not likely to happen related to the brain. So these are some common thinking methods that we applied in our clinical practice. As you can see, these are purely theory, and we actually don't, when we apply the way of thinking, we don't really think about these aspects. It's just for your references. You will know this is the theory that we apply in our practice, and also the way of your training. Until now, when you started, you already include all these aspects in your practice, such as the pedagogy. That's why I said it's important to include the negative symptoms in your inquiry, the negative symptoms in the prior disease history, the related negative symptoms. That's for the purpose to exclude some diseases. Apart from the previous thinking method, there are also other approaches that you can apply in the clinical practice, such as the trial. The trial approach is something that is specifically used when you are not clear about the cause or the situation. For instance, a patient presents with constipation, but you are not sure is it an excess syndrome or deficiency syndrome. So what can you do? You can use a very small dose of the formula to cause diarrhea. If the patient experience with still is the patient is still experience with constipation, then it is possible from an excess syndrome. If the patient presents with diarrhea or loose stool directly, then it is more likely to be a deficiency syndrome. That's because a deficiency syndrome causes constipation, and then if you use the herbs to cause diarrhea, it will, even very small amounts, it will cause diarrhea. But for excess syndrome, these small amounts of the medicine is not enough to cause diarrhea in an excess syndrome. So in this situation, it's very similar. Your enemy is very strong, and then you only use one soldier to fight with them. The results, obviously, you're going to fail, which means the patient will still present with constipation, with an excess syndrome. So these are clinical trial that you can do, although we don't do that often. only be applied when you are not sure about the condition. The assumption is actually we're going to diagnose according to the characteristic of the disease, such as a patient presents with a liver yang or liver fire, then the patient will or the patient is more likely to happen with tremor, trembling, kind of vibration. In this situation, that's because of the liver yang transformed into internal wind. The other situation, a patient presents with blocked heart vessel, such as the patient with a heart attack, and then the patient has chest pain, and then all of a sudden the patient presents with pale complexion, cold sweat, very weak pulse. So in this situation, we know that the patient is possible to have the yang depleted, the heart yang depleted. So these are the assumptions from the manifestations. Empirical methods, these are especially for some difficult cases. We're going to analyze, we're going to treat according to the experience, either from you or others, something you learn from others. So that's something you also can do. The tracing method. The tracing method, you're going to trace the manifestation one by one. What's the possible causes? You're going to analyze what's the possible causes of each manifestations, and try to exclude the impossible diagnosis. So these are some common thinking approaches that we can use in our practice. And for the comprehensive application, we're going to introduce until here. From this session, we're only going to tell you some theory that we use in our practice, as their theory we actually learn from our clinical practice. You use this as you learn as you use this. We don't only learn from the theory only. So this information, you can have a general idea in your mind, and then we're going to focus more when we go to the clinic in the third year. Thank you for your attention.